Hello. I have a little thing to talk about. I always show up on this channel and say, I'm going to keep it short, and I don't. My videos tend to be about 20 or 21 minutes long. I'm going to keep this one at about 11, 12 minutes. So I want to talk to you a little bit about the mechanics behind the modality that we use on this channel. So the question for you, if you're a mental health professional, is, should I learn a new treatment modality? No one can answer that for you. But if you're finding that what we're doing on this channel feels really helpful or effective to you, that's something to consider. So I'm going to be teaching AIT Basics seminar on September the 12th, 13th, and 19th. That would be a Saturday, a Sunday, and then one more Saturday from 9 a.m. to 5:30 p.m. Central Standard Time. And we're looking for interested mental health professionals, and that could be anyone who has a master's degree in mental health or a related discipline. That could be social work, psychology, public health, but also anyone in the nursing field or in the medical field. Okay. If you've been on this channel long enough, you know that I am a silly little goose. But what I also am is a researcher, a trauma therapist, a graduate professor, and someone who I would describe as in recovery from trying to have there be a solid scientific answer for everything. There's just too much that's unknowable. I would describe myself today as an enthusiastic weirdo. And if you've ever heard me talk long enough, you'll hear me say something to the point of, what are we doing trying to be normal when trying to fit into a world that may not have been made for us is what got us sick in the first place? There's my favorite meme, because that's what I'm like too. Trying to have a normal conversation, end up talking about all manner of stuff. So, what is AIT? You could call it an energy psychology modality, and that would be correct. But because that is a very broad umbrella term, we describe AIT, or I describe AIT, as a combined cognitive and somatic therapy that's based in touch. It's a depth-based psychology with significant reference to Carl Jung and transpersonal psychology. So, depth psychology means that we think the past is present until you heal the past so that the effects of the past are not running your present day life. And transpersonal psychology, which nobody taught me about in graduate school, is based upon the idea that there has got to be some greater wisdom than the deepest or the best and the brightest minds of human intelligence. There's got to be something greater or bigger out there in this world that we can connect to, which would then change our brains and give us a higher quality of life. AIT is also a highly manualized approach to treatment, which is a huge relief for new trauma practitioners. I regularly say to my AIT Basics students, good AIT practice is you sitting with a manual open on your lap going, hang on, let me just check what to do next. There's nothing wrong with that. That means that you're following the protocols. So then, what do we mean when we say something is an evidence-based practice? For me, the language shift of, what is standing in the way of making something, quote, scientific is how you define it. And those are just words. So instead of saying you can close the electromagnetic loop of the energy centers in your body with the energy center in your hand, I can't tell you that that's not what's actually happening. I don't know. What I can do is put it into language that colleagues of mine who are not energy psychology enthusiasts could understand. I didn't say enthusiasts the way I wanted to. What stands in the way of an intervention being evidence-based, however, is a lot more concrete. We have to assess if it works and then show it to someone else who doesn't already speak your language to see if they go, oh, okay, I think I'm getting the same effects. So you don't just go, well, everybody I know who likes it says it really works. You've got to go somewhere else and document what's happening. And that can be in a research study, that can be at a different university, that can be in a clinic setting. And I follow the American Counseling Association Code of Ethics, which talks about you need to have a scientific basis for treatment that have an empirical or scientific foundation, but it also does make room for the fact that people are going to have innovative theories and techniques. So we should promote the use of novel, innovative techniques if we think they work, but we do need to talk about the fact that if something's new or doesn't have as large of a body of research, what might be the potential costs or benefits of that. It was never on my life bingo card to be a clinical researcher in my professional career. It just kind of happened to me. So does it work? In the later part of 2025 and a good part of 2026, I conducted what's called a pilot study on AIT's three-step transformation at the small liberal arts college that I am a professor, an adjunct professor at. I and a student intern collected data from 22 research participants. The reason I wrote it this way in language that I, Elizabeth, can understand is that I'm not a statistician. And I would not have been able to do the in-depth statistical analysis that my colleague did. So I was massively relieved when she said she was willing to be my statistician so I didn't have to do it. So overall, treatment worked. People's trauma symptoms decreased because of the use of AIT. When we say significantly due to treatment, what we mean is the statistical analysis was conducted to make sure that we were ruling out that it wasn't just the positive effect of being in therapy at all. Big improvements for most participants. So before treatment, 36% of people met criteria for PTSD, and after treatment, only 9% of people still met criteria. Another way to say this is that nearly 60% of all participants showed clinically significant improvement, meaning their symptoms dropped 11 plus points on the PCL-5 scale. That's a screening instrument that we used. But other people showed moderate improvement or minimal improvement. But broadly, pretty much everyone that we saw, with some very few exceptions, experienced some amount of improvement from using AIT to treat a trauma memory. Some symptoms improved more than others. The biggest improvements were in negative thoughts and mood changes. Negative thoughts might be about self, others, the world. I'm not safe. Other people can't be trusted. And hyperarousal is that like activation or sense of like hypervigilance. This is an overactive nervous system trying to protect from trauma happening again. What that ultimately does to somebody's body is that they're swimming in threat chemicals, and that's terrible for you physically. Smaller improvements were seen in re-experiencing trauma memories and avoidance behaviors. So, but what is it actually? We use AIT in almost every video that's on this channel. That is the create a phrase, put a hand, like get a number for how strong or true it feels, and then put your hands through the midline energy centers in your body while repeating that phrase. There's a different video on this channel that talks about some of the proposed mechanisms of action on AIT. I'd be happy to do another one of those again. So we use that intervention here all the time. So you know what it feels like if you've been following this channel. But in AIT practice with a mental health clinician who's trained in AIT, it looks a little different. So psychodynamic or depth, meaning that we think that events in the past have an effect on the present, and that trauma research shows this as well. So this example would be the originating event. I fell off the swing and broke my arm when I was 4. And that would have been like a pretty disturbing or distressing experience, a lot of pain, a lot of terror, shock. And so treating that with the protocol, the hand placement at the energy centers, repeating this exact phrase, letting any emotions, sensations, or beliefs, memories come up as the body is reprocessing this memory. And then bringing it into the present. What are the effects or the symptoms in the present because this happened in the past? Well, today I feel afraid that something bad will happen when I'm having too much fun. So this person might not get a sitter and go out on a date with their spouse, and they wouldn't make the connection between that and the fact that they fell off the swing and broke their arm when they were 4. So we treat the initiating or the present day symptoms. Today I feel afraid something bad will happen when I'm having too much fun. And then what is so powerful about AIT is we consciously make the unconscious alive for us so we can break the unconscious connection. I don't love how I just said that, but basically, because this happened in the past, today I do this in the present. So then what that person gets is just a little bit more space the next time their partner goes, I would like to take you on a weekend trip. And they go, oh, we can't. And then they go, no, it's okay to let the kids stay at my mom's for a weekend and go do something. That split second of space to go, I'm not 4 years old anymore, and I'm not being run by my nervous system reactions of threat. And then a core belief that might arise as a result of that trauma. Bad things happen if I relax and enjoy myself, and installing something that's more positive. It's okay to relax and enjoy the moment safely. What we're trying to do in AIT is help our clients uncover, quote, their true selves. And we would describe this as a spiritual experience. Um, the opportunity to actually get a chance to have peace in the present and live your own life instead of a life that's run by unconscious traumatic reactions. This is a quote from one of the meditations that is in an AIT, the AIT Basics manual. This is the real you, the one you have always wanted to be, the you that has been covered up at least partly all these years. The diamond within, your center, the reality underneath the pain and wounding you have suffered. And so, if you are a master's degree holding mental health professional or higher, you have a PhD or you have a different set of credentials, you're in another healthcare profession, please consider enrolling or registering for this seminar if you have found what is on this channel to be effective for you. And the registration link is going to be in the description for the video. If you are not a mental health professional, but you think someone else might enjoy that video, please like, subscribe, share this with other people so that we can get the word out about this incredibly powerful modality. Thanks for being here.